Thank you, Margaret.
Okay. Good morning and welcome to the Primary Care Commissioning Committee meeting. I'm Margaret Geary, lay member, and will be chairing the meeting today. We're meeting virtually in response to the limitations placed on governance by the COVID-19 pandemic. Due to limited technical capacity this morning, it has not proved possible to live stream this meeting today. The meeting will be recorded and then uploaded onto the NHS Portsmouth Clinical Commissioning Group website as soon as possible. Papers for the meeting can also be viewed on this website. Committee members and attendees are asked to keep their microphones on mute and to only turn these on when they are called to speak. Please use a raised hand to indicate that you wish to speak. Agenda items that require a decision will be confirmed by a raised hand by committee members only. Prior to presenting their agenda items, attendees should state their name and job title and, where possible, turn their camera on. I will now ask each committee member to turn on their microphones and confirm their name and title. So I can start with Mark Compton.
Morning all, Mark Compton, Director of Transformation for Portsmouth CCG.
And Dr. Nick Moore.
I'm Nick Moore, GP, Clinical Executive on Portsmouth CCG.
Okay, Nick, I understand this is your last meeting.
It is. It's my last day at the CCG today, so I'll be saying goodbye to you all at the end.
Just yeah, thank you, thank you very much for your contributions. Yeah, we shall probably repeat that at the end as well. Okay, Andy Sylvester, is he here today? No, doesn't seem to be. Michelle Spandley, is Michelle joined yet? We're expecting Michelle, so she may join shortly. Joe York, again, Joe, we're expecting, but isn't here today, and here yet. Can I then ask Lisa Harding? No. Christine Horan?
Hi, Chris Horan, Primary Care Improvement Manager for Portsmouth CCG. Thank you.
Sorry, Chris, I'll keep calling you Christine when you clearly want to be called Chris.
That's all right.
Justina Jeffs.
Good morning, I'm Justina Jeffs, Head of Governance for the CCG.
Sylvia Macy.
Good morning, Sylvia Macy, Acting Deputy Director for Primary Care.
Stephen O'Rubio.
Hi, I'm Stephen O'Rubio, Clinical Quality Manager for Portsmouth CCG.
Will Harvey. Will Harvey.
Hi there, I'm Will Howard. I'm a GP and I'm a Medical Director at Wessex LMC.
Very good, thank you. Okay, can I then move to apologies? We've had a string of apologies, which will be minuted probably more comprehensively than I'm going to say them, but they are Helen Atkinson, Dr. Linda Colley, Julia O'Mara, David Scarborough, and just to make a note, Dave has actually resigned, so he's not going to be at future meetings, so we are going to miss him really quite badly, I think, because he was very helpful as one of the practice managers in one of the GP practices. Roger Batterbury has sent his apologies. Jason Eastman has sent his apologies. Simon Cooper and Steve McInnes has had a car breakdown this morning, so he's unlikely to be here. And I think we're also missing Andy Sylvester, and we've had apologies for him on a long-term basis or a medium-term basis. Okay, thank you. Can I then look at the register and declaration of interest? Are there any declarations of interest that are needed today on any of the agenda items? Nick?
Obviously, as I'm a GP in Portsmouth, particularly I think in relation to the agenda item about the list changes, PMS, that's item 7, I think, because I work in the neighbouring practice.
Okay, thank you. I think that's an indirect interest, so you should be able to, to participate in the meeting. I've also got an indirect interest in the Afghan item because I'm a trustee on the charity that has been commissioned to support Afghan families in the city. But again, it's an indirect interest. Can I then move to the minutes of the previous meeting? 7 pages of minutes, so page 1, let's go through each for accuracy and any items people want to raise that aren't already on the agenda. Page 1, page 2, page 3, page 4, page 5, and page 6. And I then move to the matters arising and the actions. And I think most of these are on the agenda already and will be covered today on the agenda, apart from the Guildhall Walk Healthcare Centre, which is scheduled for January. Okay. Thank you. Can I then move to the next item on the agenda, which is the primary care risk register?
Thank you, Margaret. So there are a number of risks on the risk register, which I hope you've had a chance to have a quick look at. The two that are highest risk are the practice viability and the access to urgent care. Practice viability is mitigated by active engagement with the practices by the primary care team, monitoring the quality of primary care delivery, CQC, and practices working in primary care networks. Access to urgent care is mitigated by the acute visiting service, which is in place to relieve some of the pressure, and the GP enhanced access service. And the primary care team are working with practices to support the creation of some additional capacity as well, which we will discuss in actually part 2 tomorrow. I know that the quality QSEC meeting has asked for a couple of items to be added, but there wasn't time to add them before the meeting as the papers had already been circulated. So next time we will be adding a risk around patient behaviour, which is really challenging to practices at the moment. And also the lack of workforce will also be added to the risk register. Thank you, Margaret.
Okay. Are there any questions or comments on that? I have one question, a couple of questions. One is about the practice viability one. You talked about capacity and you've mentioned the quality committee's extra risks to be added, but I did wonder whether those pressures that are talked about under viability should be specified more, because one is recruitment and retention, surely. Yeah. And there must be other pressures there that we need to be, that are risks in themselves, if you like, that contribute to that. But it's not very clear from the current risk register what those are and what we therefore should be monitoring. Don't know if Nick feels any differently about that. I'd be interested.
Sorry, Margaret, I'm just on mute. I'm just trying to bring up the page again. What do you mean particularly, Helen? I'm sorry, Margaret.
Just about the retention and recruitment being a specific issue, and a specific risk for primary care, and some of that just gets lost in the broader title.
No, I would agree with you. Actually, I think it probably is something that we should probably articulate a little bit more overtly, really. I mean, we've got some data, haven't we, in the later part of the paper about the number of patients per GP related to the practice changes, and I think maybe we might be worth trying to articulate that maybe with the risks. That may be a way of highlighting that a little bit better.
Yeah. Okay. Will.
I would just say in relation to that, equally adding in practice nurses and practice managers. Practice managers are something that are shedding very rapidly and really are a big risk to practice sustainability at the same time.
Okay. No, I think there are just issues around that specific recruitment and retention thing that need to be much clearer, I think. The other question I had was whether we needed 2 risks on COVID-19. Simply because they're aspects of the same risk, it seemed to me. Yeah.
I can definitely look at that, Margaret. So I will bring a refreshed risk register back to the next meeting.
Okay. Thank you very much. Okay, can we then move to the next item on the agenda, which is the primary care finance summary. Andrea, I think. Is Andrea here, or is it Michelle? Are you doing? I know you've just arrived.
Apologies for that, Margaret. I believe Andrea might be poorly, so hence why you haven't got anybody. In terms of the finance report itself, you'll note that it includes a full finance report because it's the half year. We decided to include that just for context. And then there's the summary page in terms of the primary care elements within that. I don't believe we wanted to highlight anything particular today to you because it's not much different to what you've seen previously. So it's here for the record.
Are there any questions or comments on that? No. Fairly comprehensive report. Thank you. Okay. Can I then move to flu and COVID vaccination programs update? And I think Sylvia, this has fallen to you today because of
it has. It'll just be a very brief update, to be quite honest, and I'm hoping Chris will be able to just say a few words about flu because she's more informed about that than I am. So basically with the COVID-19 vaccinations, you know, the practices are working really hard. Cohort 10 has obviously been added in. Cohort 10 is the 40 to 49-year-olds. And the 16 to 17-year-old second doses has also been added in. PCNs are working to do all of those. The care homes are mostly completed. I think there's a couple that are for various reasons which haven't been quite finished, but across the city, nearly all the care homes have been completed in terms of the booster vaccines, and practices and PCNs are now looking at the housebound, which is going ahead. It's a little bit slow because of the time that it takes to wait for the 15 minutes post-vaccination, but it is going ahead. So that's probably as much as I can tell you, really, unless there are any specific questions about the vaccination programme.
Are there any questions? No. Chris, I think then we're over to flu vaccinations.
Yeah, so across Hampshire, Isle of Wight, they're doing fantastically well on their uptake for the flu. So here in Portsmouth, I'll break down the cohorts and just let you know where we're at the moment. So age 2 to 3, we're about 40%. And 65 in at-risk groups, again around 40%. Pregnant ladies 40%, and age 50 to 64 around 40%, and then our 65 plus we're around 70%. So our practices have been working extremely hard to get those and to increase that uptake, but we're on target really to hit those sort of aims we've got here across Portsmouth. Pharmacy as well, they're actually up by 40% in comparison to last year for their flu vaccination. So again, they're doing an absolutely fantastic job. So I'm working very closely with our Portsmouth practices. So we have a meeting every 2 weeks across Portsmouth, just to get some feedback and work closely with them, and any support at all that's needed. I'm sort of linking in with all of our practices, but yeah, we're getting there with our uptake, and as I said, they're just doing a fantastic job.
Okay, thank you.
Okay, thank
Thank
you.
you very much. Any questions, comments? All signs as if it's progressing well.
Yeah.
Or as well as we can expect. Will.
Thanks. I just wanted to note the pressure that the vaccination programmes as a whole are placing primary care under, and I know that's well recognised, but it's important that it is noted. Equally, that we need to find, given that the cohorts seem to be added by the BBC News on a regular basis, it's important for us to think of future provision, not just that networks and practices will be able to continue to pick this up relentlessly. If this is going to be ongoing year on year, then actually the vaccination programme needs to be considered as a separate service from primary care, and that primary care may be able to support that delivery, but it should not be relied upon to be the sole provider for the future.
Really good point. Thank you. Mark.
Yeah, really good point, Will. And some fantastic progress, I think, on both fronts in terms of COVID and flu vaccinations, which are really heartening to hear. I was just going to ask a specific question around the COVID one. It was on the back of nationally being raised as an issue, I guess, and some high risk factors around it in terms of pregnant women having the COVID vaccine. I was just wondering how we're doing kind of locally around that. Do we know, and is there anything more that we can be doing, given that seems to be a real issue and some real kind of risks associated with some of that?
The honest truth, Mark, is I don't know how we're doing. I suspect we're pretty much on the national average, but I can't honestly tell you. I will try and find out and circulate something to the meeting, but I certainly can't tell you off the cuff, sorry.
No, that's fine. It's just one of those things where if there's more that we can be doing just to help that area, it would be helpful if we could support it. Yeah,
totally agree.
Any other comments or questions? So can we just note the comment about the pressure on primary care and just not lose that, I suppose, in terms of our future meetings, so that we attend to some of those kind of issues. It may be another risk, and that's certainly, it's part of the pressures that we're talking about when we talk about viable primary care services. But yeah, okay. Then can we move then to personal medical services, and again contracts, and I think that's starting to Sylvia again. Obviously Steve's car is in a bad way, so
it's one of those meetings, isn't it? So as you'll be aware, when it's a PMS contract, the partner changes need to come to this group to be agreed and approved. So we have one as item 7 on the agenda, which is the Portsdown practice, which have 2 partners leaving and 1 joining. And you will see the details in the paper. So really it's just a request that the committee agree it. So I'm kind of looking for any questions and or agreement to the Portsdown changes.
Nick.
Yeah, but it obviously wasn't for me to agree this necessarily, because I mentioned a conflict, but it was just really just to highlight about where this fits with sort of average numbers of patients, list size per whole time equivalent, etc., because that really isn't evident from the narrative, and that applies to obviously all of those things. And just with reference to my comment earlier on, because I think obviously one would probably have to approve these, but where that fits in terms of the resilience of the practice and how that reflects the accessibility of services to patients, etc. really, and I wasn't sure whether we maybe need to be clearer on that or something to come back to highlight that.
So I agree, and I think so it's difficult now because it isn't just GPs numbers, is it? Because it's the extended primary care and all the other roles and how they fit in. But I think perhaps we need to add a question in when these come in to ask whether how those, if it's somebody leaving, how those sessions are going to be covered. It may not be a GP, but what they're actually looking at and what their changes are. So I think the team need to perhaps look at just asking a few more questions to give us a bit more assurance around partners leaving. So I will take that back. Thank you. Okay. And then there is another partnership change which has come round quickly this morning as an AOB, which we thought is probably the time to do it is now as well, and that is the addition of the nurse practitioner at Lake Road to be added to the partnership. So people may not have had a real chance to look at it, but it is an addition which can only support the primary care team.
Okay, so we're asked to approve both the Portstown and the Lake Road amendments to PMS. Noting, as Nick has done, that we may need to amend the questions, how we present this in the future in terms of the information contained in the report. Okay, can I ask for your approval? Are people happy with that, to approve these? Okay. Don't hear. Yeah, I'm going to take silence as approval. Thank you. Okay, can I then move to the next item, which is the Afghan relocations and assistance, the primary care role in that?
Thank you, Margaret.
Sorry, Sylvia.
No, don't worry. So you will remember this came to Primary Care Commissioning Committee before. It's to support practices where they are registering Afghan families. Due to the number of checks and vaccinations and additional requirements that these people need when they register, we've recognised that there needs to be a bit of additional support, because it can take, for a family of 6, a whole day of clinical time or clinical stroke admin time. It takes a long time to make sure everything's in place. And so this is a specification to support practices. I think there's only 2 currently that are doing this, but it may expand depending on numbers. We have checked with finance. There is sufficient money in the budget to do this, although it is a little bit open-ended, I do agree, but we're not expecting hundreds of people. And everything really is contained in the paper. So it's really whether there's anything that anybody wanted to have any questions about, which I hope I will be able to answer.
Any questions or comments? Anyone? Will?
Sorry, new to the group and I keep sticking my hand up. I apologise. I think we've had a good look through them from an LMC perspective representing primary care, and I think the reality, the real question is there capacity in primary care to deliver this over and above the normal day? And I think the practices themselves need to answer that question. Is there going to be an appetite? And from the CCG's perspective, there's the risk that they might just go, no, we can't do this. Now, I think that's very practice dependent as well. And so what is plan B? Because if local authorities are handed the responsibility to settle Afghan refugees in the area, how can they be managed if practices are unable to take this on?
And I think that's an excellent question, Will. I think we have certainly initially said, patient choice, lists are open. We would expect, with some support, this to happen. If we have a very large number, then obviously we will have to look at it. I know that the initial numbers were quite small, and I spoke to both of the practices to ensure that they were okay to do it. And the feedback was, yes, we can do it, but it does take us a lot of time. It does cost us a lot, hence the scheme. So I think at the minute we've done everything we can. There isn't necessarily a plan B particularly, but we will work with practices to try and make sure that they're not overwhelmed. But I don't think the numbers are actually as big as they sound, but completely appreciate that it does take clinical members of the team a reasonable amount of time to do these checks and vaccines and things.
So I think one of my concerns would simply be, and again, you've spoken to the practices, which I very much appreciate. You've had it from the horse's mouth. Practices tend to say yes to pretty much anything and then have a go at doing it. The risk then is of quality of delivery as well as quantity of delivery. You can't do everything for everybody all of the time. We always want to help patients. That is within our that's why we became GPs quite a lot of the time. So we want to say yes and do the best we can, but it has to be both safe and achievable, because otherwise you run the risk of practices actually not being able to achieve their core contract in relation to this.
I think what we've done so far is to try and spread the load, as it were, across the practices, and to give them as much warning as we can that these patients might be coming or will be coming to them, so that they've got a little bit of time to adjust staffing and prepare where they're able to. So I agree.
I just also report from Julia O'Mara, who couldn't be at the meeting today, but has been in touch with some of the practices involved in this, and with one of them in particular. And she was saying the practice nurse manager at the practice who are providing the Afghanistani relocation scheme has reported that the health checks are going well and almost completed. The baby and child vaccinations for all of the families is going well. And one family has received the first 2 lots of vaccines and just need their boosters. So, and I think she is offering support and is pointing them in the direction of some of the guidance that exists. Okay.
That's fantastic. Thank you.
Okay. Mark.
Thank you. Really heartening to hear as well that it's seemingly going well, and it's a great scheme, isn't it? I was just reflecting on the fact that obviously this is specific to Afghanistan and the particular issues that are there. Do we have a similar scheme for kind of any refugees to ensure that they're getting that kind of enhanced level of checks and care and vaccinations, etc., and that practices have the ability to do that?
So the simple answer is no. The more complex answer is when Syrian refugees were coming over a couple of years ago, the government actually funded some of the scheme. And there was a payment not just to GP practices, but also into secondary care where that was required. This scheme of resettlement has come with absolutely no funding from central government. Therefore, that's why we have put this in for the Afghan refugees. I'm not aware that there are huge numbers of other refugees in our area, but I'm sure that if there are or were to come, that is, then we would look at that. So the simple answer is no, but we will keep an eye on it.
Yeah, thank you. And I think that's the point, isn't it? I think any of the refugees who are coming over should receive the same level of care, not just because there's a specific issue with Afghanistan at the moment. So it's just making sure we've got the kind of frameworks and infrastructure in place to make sure that we do that.
Absolutely. I think, Mark, we were sort of thinking that, you know, the small number potentially of other refugees may be okay for the practice to absorb, but when you begin to get more significant numbers, we needed to actively do something to support the practices, to enable them to say, you know, some of their staff, maybe they could work a few extra hours to do these specific checks and vaccines, etc. So the simple answer is no, but we will keep an eye on it.
Okay. Any other comments, questions? No. Okay. Can I then move? We don't have. Is there any other business at the moment? Haven't had any notice of it. Right. It just remains for me to say goodbye to Nick, who's leaving us, and this is his last day at the CCG. So, just thanks, Nick, for all that you've contributed, not just to this committee, but across the board, really. And really, best wishes for the future.
Thank you very much. Thank you very much. Yeah, well, good luck to everybody. Obviously, we're a bit uncertain where things are going, but I'm sure there will be something. Lots of these things will continue, and no one's irreplaceable, are they? There'll always be someone else to come into your shoes. So, thanks for those kind words, Margaret.
Oh, well meant. Okay, thank you. Our next meeting then is on the Wednesday, the 26th of January, at 2020. That's going to be at night. It's at the moment scheduled for 9:45, but we may need to change that if it clashes again in the way it has this time with other meetings and people can't be here. So I think we'll just keep an eye on that date and time and try and adjust your diaries for it. Thank you. Thank you all for attending and see you soon. Thank you.
Thank you, Margaret.
Thank you.
Thank you. Bye.
Margaret.